If you've been dealing with dull, achy, pressure, pain in either one or both of your testicles for weeks or even months, this video is for you. Chronic testicular pain is way more common than you think. It affects about 1 in 100 men at some point in our lives. The pain can be dull, it could be achy, it could be sharp. Any type of pain that you're having in the testicle can be a reason to see a doctor. Having said that, a lot of men see primary care doctors or urologists and they're told that everything is fine. Even if that's the case, it does warrant looking into to see what the cause of this is. I'm Dr. Justin Houman, a fellowship-trained men's health specialist at Cedars-Sinai, and we're going to go over chronic testicular pain, everything about it, the causes, the symptoms, and what you could do in order to treat it. First, let's define what chronic testicular pain is. When we say chronic, we usually say that it lasts about for 3 months. Having said that, even if you're experiencing pain for days or weeks, it does warrant seeing a doctor in order to see what the cause is. We usually say about 2 to 5% of men experience some form of chronic testicular pain throughout the course of their lives, and it accounts for about 1 in 5 visits to a urologist's office. Let's go over the causes of testicular pain. Number 1, epididymitis, or epididymal orchitis. This is when the structures of the testicle, or around the testicle itself, as well as the epididymis, these could become inflamed or they become infected as a result of a bad UTI or a bad STD. Anytime an infection gets into that area, it does cause severe pain, just given the fact that there's so many nerves there, and it creates a lot of pressure. The testicle can get quite swollen. The simplest treatment for this is a good antibiotic, an antibiotic that's sensitive to the bacteria that you have in the testicle. Many times it's E. coli. So we put you on an antibiotic for anywhere from 10 to 14 days. Even after the infection clears, the pain can persist just because of the inflammation. So you have to be quite patient when it comes to the pain associated with epididymitis. It does take some time for the antibiotics to work, and within a few weeks you should be back to normal. Number 2, varicoceles. So varicoceles are probably the most common cause of testicular pain. Many men don't realize when they have varicoceles just because it's a very progressive thing. Some men have a varicocele as soon as they hit puberty. But what it is, it's dilation of the blood vessels around the testicles. This creates pressure in the testicles, a dull, heavy achiness that gets worse throughout the course of the day around the testicle. Usually impacts the left side, but it could definitely impact the right side as well. Many times we see men with bilateral varicoceles, but again, primarily it's on the left side. The varicoceles are a result of really just the way you're born. A lot of times the valves that are supposed to help drain blood back to the heart from the testicles, they're incompetent or they're not working so well. So blood pools around that testicle, and again, it creates that heavy achiness. In addition to the pain associated with varicoceles, it can negatively impact your fertility as well. And in some cases, it can impact your testosterone levels. So if you feel like you are experiencing some testicular pain, a lot of times it may be a varicocele. So seeing a urologist in order to determine if you have a varicocele as the cause of your testicular pain can be quite important. In addition to that, the treatment for a varicocele is relatively straightforward. It's a microsurgical varicocelectomy where we isolate those veins that are causing that blood to pool, isolate them, tie them off, and really the recovery is relatively simple, about a 1 to 2 week recovery, and you're back to normal without any testicular pain. Another cause of testicular pain is a spermatocele. So a spermatocele is when you have a cyst coming off the epididymis. So the epididymis is the structure that's attached to the testicle. It's where sperm go to mature. So once sperm is made in the testicle, it goes into the epididymis where it matures and it's ready to be ejaculated so it could do its function. However, in that epididymis, sometimes there's cysts that develop. So that sperm isn't so much going out to the outside world, instead it's getting into this cyst. And over time, that cyst could slowly start to increase in size. And that increase in size can cause pain in some men. Many times it's just a cyst where men don't even realize they have it, but in some cases it could cause pain. Spermatoceles are benign. There's no problems with having a spermatocele, but if it is causing pain, we could definitely fix it. The treatment for a spermatocele is something called a spermatocelectomy, where we isolate that cyst, find it, tie it off, and by doing so, we're able to correct that cyst, and ultimately you're able to resume normal, healthy living without any testicular pain associated with it. Inguinal hernias are another cause of testicular pain. As you can imagine, where the hernias can start to form, and for inguinal hernias, it's right next to the spermatic cord. So anytime that inguinal hernia is putting pressure on the spermatic cord, on the nerves around the spermatic cord, it could increase the sensitivity of those nerves and reproduce this sense of pain that you're having all throughout that spermatic cord as well as the testicle. The type of pain with that one is slightly different, as you'll feel the pain higher up, closer to where the spermatic cord comes out of the abdomen, not so much directly as a sharp pain down in the testicular area. One other thing associated with hernias is there could be a bulge. A lot of times when you have an inguinal hernia, you see a bulge in your lower abdomen. That's somewhat telling that this is an inguinal hernia rather than any of the other causes that we've talked about for testicular pain. But if you are experiencing this bulge, seeing a general surgeon in order to fix that inguinal hernia can be quite helpful for addressing testicular pain. Hydroceles are another cause of testicular pain. So hydroceles are when fluid accumulates around the testicle. So think of the testicle, it's in your scrotum obviously, but around it has this lubricating fluid that allows the testicle to roam freely. However, at times, what happens is the fluid comes from the abdomen. As much of it comes in, the same amount goes out. As we age, or sometimes due to trauma, pelvic surgery, fluid that comes in doesn't necessarily work its way out. So that fluid starts to accumulate in the testicular area, in the scrotal area, and over time it could create this big fluid collection, sometimes the size of an orange, sometimes the size of a grapefruit. And that could create obviously a sense of discomfort, a heaviness associated with the scrotal area. That's quite obvious when you see that. You see a guy coming in with a very large testicle. It's quite telling that's a hydrocele. The treatment for this is something called a hydrocelectomy, where we go in there and we're able to not just remove the fluid, but remove the sac that collects this fluid. It's called a hydrocelectomy. It's relatively straightforward, outpatient procedure, and the recovery from that is about 1 to 2 weeks. Testicular torsion is a very emergent cause where it requires emergency surgery when it comes to testicular pain. Testicular torsion is when the testicle twists on itself and normal blood flow is going to the testicle. So if you do have a severe sharp pain in that testicular area, it doesn't matter which side, where you do think that the pain is so severe, you do have to go to an emergency room, get evaluated, get an ultrasound, make sure we're getting good blood flow to the testicle, and ultimately, if you do have some form of testicular torsion, get emergency surgery. Nerve-related pain is a very common and underdiagnosed cause of testicular pain. So the nerves, the ilioinguinal nerve, the genitofemoral nerve, and the branches of the pudendal nerve, all of these are involved in innervating or sensitizing the testicle itself. So a lot of times when you are experiencing some form of testicular pain, and we ruled out everything, whether it's a varicocele, torsion, infection, epididymitis, any of those, a lot of times it does come to the fact that it's these nerves that are hypersensitive, they're compressed, they're irritated, they're inflamed, and that's the cause of the testicular pain that you're experiencing. Again, it's very underdiagnosed. Even urologists who see patients on a regular basis don't necessarily have the ability to diagnose this. So again, if you are experiencing testicular pain where everything else has been ruled out, this is what we think of. Now, this is more common in people who are cyclists, for example, truck drivers, people who sit for prolonged periods of time, people who have had trauma to the pelvic area, prior hernia surgeries, prior pelvic surgeries. Anything that has irritated the pelvic area, and again, it's impacting the ilioinguinal nerve, the genitofemoral nerve, or the pudendal nerve, this could all cause this very chronic testicular pain that for myself, at least in my practice, I see a lot of patients with this. The pain associated with nerve entrapment or nerve compression is more of an electric pain. It's a stinging pain. It's a sharp pain. It's not so much a dull achiness that varicoceles have. But if you are experiencing this, the good news is that we have a good solution for it. It's called a microsurgical denervation. We're able to isolate these nerves, these compressed, irritated nerves, tie them off, and basically prevent them from transmitting that pain signal. And many men do quite well. I like to say about 90% of guys have good relief after the surgery. Another cause is post-vasectomy pain syndrome. So I will say this is quite rare, but some men do experience pain after a vasectomy where the nerve fibers around that vas area, the vas deferens, for whatever reason, they get irritated afterwards. If those nerve fibers, the vasal sheath is involved in the vasectomy itself, it's not being fully stripped, it could irritate some of those nerves that we discussed, the ilioinguinal, genitofemoral, as well as some branches of the pudendal nerve. Sometimes what happens is those nerves get hypersensitive after the vasectomy, and ultimately these patients experience chronic testicular pain. If we ruled everything else out as a cause of testicular pain for a patient who's had a vasectomy, some patients have to undergo a vasectomy reversal in order to fix this pain, in order to address this pain. By opening up, by allowing that vas deferens, connecting it back to its original site, what happens is it relieves some of that pressure associated with the vasectomy, and ultimately helps relieve a lot of these guys who have chronic testicular pain after a vasectomy. If you are experiencing testicular pain, obviously you want to see a urologist who specializes in testicular pain. And the key thing is figuring out what the cause is, because rest assured we have a number of options. It all depends on figuring out the correct diagnosis. Once you have the correct diagnosis, we'll figure out what the right treatment is. In terms of the visit and what you're going to experience during that visit in order to find the right diagnosis, obviously a physical exam just to make sure we're able to see what's going on within the testicular area, within the groin area, the abdominal area, to see if there's any potential hernias, varicoceles. Sometimes it'll require an ultrasound or scrotal ultrasound to see if the veins, those varicoceles, are actually really dilated, if you do have a hydrocele, if you do have epididymitis. So scrotal ultrasound is obviously quite important, the physical exam. Not so much on the blood work side unless you are experiencing a severe infection. A urinalysis to make sure that you have no infection in the urine, that UTI that's causing some of this testicular pain. But that's really the workup when it comes to testicular pain. When it comes to our philosophy for testicular pain, I will say it's kind of nice because for about 90 to 95% of guys, we're able to provide some form of relief, where they're able to get back to their normal healthy living, sexual life is returned, they're not so anxious, they're not so depressed associated with this testicular pain. Usually it starts off with some kind of conservative management with anti-inflammatories, sometimes warm baths, pelvic floor, physical therapy can help as well, muscle relaxers. If those don't work, then we do something called the spermatic cord block in the office. We provide a numbing agent, a combination of short-acting and long-acting analgesics, as well as a steroid that reduces some of the inflammation around the testicle. If that works for pain relief at any point, then you're a good candidate for something called a microsurgical denervation, where we go in there and we isolate the nerves around the testicle, if this is all nerve-related. And that really does help, again, about 90 to 95% of guys in providing long-term relief. If you are experiencing testicular pain and you want to be seen, obviously we're happy to help you. Click the link below, fill out the form, and we're happy to contact you in order to get you scheduled for a visit.